Welcome back to Sleep Better TV. I'm Tasia Custodi, and I'm joined by Dr. Dawn Slayback of the Craniofacial Care Center in Columbus, Ohio. Dr. Dawn, thanks so much for joining us again.
Thank you for having me.
I want to talk about children and obstructive sleep apnea. So what's the most common cause of OSA in children?
Obstructive apnea in children, obstructive sleep apnea in children usually is caused by enlarged tonsils and/or adenoids, which makes it a fairly simple fix.
So what is the correlation, is there any, between ADHD and OSA in children? I've been reading a little bit about that.
With obstructive sleep apnea, patients, children, whatever age group, undergo stopping of breathing at night, and their oxygen levels go down so that it disrupts their normal sleep rhythm, their normal sleep stages. They don't get into deep levels of sleep, so they don't awake and refreshed. When we as adults are sleepy or are sleep deprived, we tend to fall asleep very easily, sitting in front of the TV, sitting on an airplane, sitting in a meeting. When children get sleepy, they tend to get ramped up. It's like the second wind that our kids hit at 8:30 when they're really tired and we're trying to get them to bed. So for children, we're going to have them sleep deprived, and we're going to send them off to school and expect them to focus and stay on task. And if they're sleepy, they might become that disruptive child in a classroom and get labeled with ADD or ADHD.
So how is ADHD and OSA diagnosed in children?
With OSA in children, just like adults, they need to undergo a sleep study, usually in a hospital or laboratory-based study, and diagnosed by a medical doctor. ADHD or ADD, either one, are diagnosed pretty much from a checklist. So here we have a child who's sleep deprived, might be causing some disruptions in the classroom. Teacher might recommend that they get evaluated by a pediatrician. There are no lab studies, no imaging studies for ADD or ADHD. It's pretty much done off of a checklist of behaviors.
And how is each treated?
With obstructive sleep apnea, usually, again, it's tonsils and adenoids that are enlarged, and removing them cures about 75% of the kids of their apnea. If you combine that with palate expansion, the numbers go up to about 95%. With ADD and ADHD treatments, again, are medication. Things like Ritalin, Adderall, Strattera, they're basically speed. All we're trying to do is wake the kids up, much like we as adults do with a cup of coffee or a can of Red Bull.
Thank you so much for your time.
Thank you.
My guest today has been Dr. Dawn Slayback of the Craniofacial Care Center in Columbus, Ohio, and you've been watching Sleep Better TV.